right? So when we look back at the DRC, I mean, obviously, when the DRC was formerly named Zaire, that's where Ebola virus itself first emerged from in 1976, and then actually went dormant for a long period of time. What we've seen, though, over the past decade has been basically fairly sequential outbreaks that have been occurring, and I think especially when we look at the West African epidemic onwards. What we've seen is that these outbreaks are not necessarily spread out by years; that they're maybe spread out by months in many cases. And I think that is something that we need to start to try to understand. What are the factors that are involved in this? Is it an environmental or climate related issue? Is it due to the instability and potentially the lack of proper nutrition within the region? So people are being led to to try to hunt game more frequently. Is this due to incursion into forested areas where we think that the reservoir host, being fruit bats, likely lie? I don't think we know yet, and I think it's probably not going to be one single factor as compared to probably a combination of all of these. On top of all of that, looking really at the behavioral aspects of trying to better understand from a community aspect, how can we try to address maybe some things that are culturally normal or culturally commonplace in those societies to maybe help provide better context or guidance that might reduce transmission. Ultimately, I think we do have to start to kind of address the situation from all aspects and actually devote, I think, much more time and energy into this as compared to just leaving it when we see the outbreaks occurring themselves.
So yeah, I would agree with Dr. Kindrashek. I think that there's a lot we still don't know, and I think trying to understand not just Ebola, but other zoonotic diseases from a One Health aspect. So trying to really understand how our relationships with animals, the environment, and humans, how those all interact and lead to these types of events. Because since the 2014 West Africa outbreak, there have been numerous outbreaks in the DRC, and trying to understand why that is happening. Is it because of the way that people are interacting with the environment? Is it because of changes in climate? What are the types of things that are happening that are leading to these events? And looking broader and beyond Ebola, looking at other types of infections that we're worried about, things like Marburg and Lassa, and those are not things that are just in sub-Saharan Africa or just in DRC, right? We need to think about those things in other parts of Africa, because we really do need to understand that, especially as the population continues to grow and they continue to migrate further and further out from the major cities. What types of other infections are people going to be potentially predisposed to getting? And we're seeing the repercussions of novel infection currently right now with the coronavirus pandemic. And so we need to understand those types of things so we can, in the future, better understand how to not just do surveillance for these types of infections, but then when they do appear, how to better prepare and respond to them.